Hello everyone, let me introduce myself. My name is Jasnoor, student of BSc Medical final year at Kanya Mahavidyalaya, and first of all I would like to thank our principal ma'am and all faculty teachers who organize this student mentoring. So let's begin with our topic. My topic is obesity. Now what is obesity? Generally we say being fatty is obesity. Yeah, right. Abnormal or excessive fat accumulation that has an adverse effect on health, leading to reduced life expectancy or increased health problems like heart diseases. A metabolic disorder that is primarily induced and sustained by an overconsumption or underutilization of caloric substrate. Moving to classification of obesity, it is based on fat cells and distribution of fat. Moderate fat and severe fat are two kinds of obesity. Moderate fat includes only the increase in cell size, while the severe obesity includes the number of fat cells which gets increased. So, sex-based difference in body fat distribution. There are two kinds of obesity, android and gynoid, based on the sex. And here android is not a smartphone company, okay? Android is a man, tend to carry excess fat around their abdomen part, while the gynoid, the female, tends to accumulate excessive fat in their hips and thighs. You can see in the picture attached that man appears to be like an apple while the female appears like an pear. Now body mass index BMI. So we have divided the table into two parts. Here in first we have body mass index, and then we have discussed the categories. The person who is having less than 18.5 BMI comes under the category of underweight. Person having 18.5 to 25 BMI comes under the category of healthy weight, and so on. Obesity, a global epidemic. Now, according to World Health Organization, it has estimated that currently 1.5 billion adults are overweight, 400 million are obese, and by 2015, 2.2 billion overweight and 700 million obese. Then, causes and contributing factors that lead to obesity. Complex and multifactorial diseases. Inactivity due to sedentary lifestyle. Now you can see our online classes are on, and we just lack exercise in our daily life. Unhealthy diet and eating habits, fast food, high caloric beverages, diet low in fibers, lack of sleep, hormonal changes, increased appetite, certain medications, antidepressant, etc. These all factors lead to a disease called obesity. Moving on next, again the causes. It can be genetic factor that is responsible for the obesity, overeating, hormonal factors, medications, excessive medications that we take, unnecessary medications also, smoking, sweetened drinks, insufficient sleep, sedentary lifestyle. Now, how endocrine factor is responsible for this. Leptin and obesity. Released fat from fat tissues. Leptin is a hormone that is released from fat tissues which interact with the hypothalamus, inhibits neuropeptide Y and agouti related peptide in CNS, decreases food intake and increases energy expenditure. You can see in the image attached here, food intake increases while energy expended is decreased. Fat tissues are releasing a hormone known as leptin. Now, how leptin causes obesity? Primary decrease of leptin, low leptin, leptin receptor resistant, high leptin. So, increased neuropeptide Y and AGRP, increase in food intake and low energy expenditure that I have discussed in the last slide leads to severe obesity, where the number of fat cell increases, not the size of the fat cell increases. Then complications, problems that we face due to obesity are metabolic syndrome, high cholesterol, which leads to heart diseases, cancer, sleep apnea, serious sleep disorders, and depression. We also face many skin problems such as poor wound healing. Now, test and diagnosis, taking health history, weight loss efforts, other health problems related to obesity, example diabetes, calculating BMI, basic metabolic rate, and measuring waist circumferences, blood tests, cholesterol tests, and liver function tests. Now, this is the record which we have collected, shown in two of the bar graphs. You can see the BMI rate is increases along with the ages and years. Okay, so in next bar graph we can see male students compared with the female students. The BMI classification is normal for normal in male is 26.9%, while in females it is 31.5%, and so on. And obese cases in case of male are 3.2%, while in females are also 3.2%, that is equal. So how to cure this problem now? Take proper diet, exercise daily, 30 minutes daily. Okay, so anti-obesity drugs, there are many drugs in which comes in stores, but you should take medications with the consultant of pharmacist only. Okay, surgery is also another way to overcome this problem. So now it's upon us what we want, what fits your busy schedule better, exercising 1 hour a day or being that 24 hours a day. Thank you, stay healthy, and thank you for listening.